Hello, welcome to Dental Notes and Mnemonics. Today we are going to discuss about how does the blood clot. So without any delay, let's get started with the video. Blood flows smoothly through our vessels, delivering oxygen and nutrients to every part of the body. But sometimes the delicate balance is disrupted, leading to the formation of blood clot or thrombus. But how does a clot form? The answer lies in the fundamental concept known as the Virchow's triad. Three key factors that set the stage for thrombosis. This include the damage to the blood vessels, change in the blood flow, and increased clotting tendency. Mechanism of each factors in Virchow's triad is different, but once the clot starts forming, the sequence of events leading to the thrombosis is same regardless of which factor initiates it. When a blood vessel is injured, the body immediately activates a protective mechanism called hemostasis to prevent excessive bleeding. The process occurs in 5 distinct phases, each playing a critical role in forming and dissolving a clot. First line of defense is the vascular spasm or the vasoconstriction, where the smooth muscles in the vessel contracts, narrowing the blood vessels to reduce the blood flow. This is triggered by endothelin, which is a chemical released by the damaged endothelial cells, and thromboxane A2, which is produced by platelets, and this phase is temporary but buys time for the next steps. Then come the stage of primary hemostasis, where there is a formation of platelet plug. When the endothelium is damaged, the underlying collagen and von Willebrand factors are exposed. Platelets in bloodstream adhere to this exposed surface and become activated. Activated platelets release ADP, thromboxane A2, and fibrinogen, which recruits more platelets to the site. And this leads to the platelet aggregation, forming a temporary platelet plug that seals the injury. Following the primary hemostasis comes the phase of secondary hemostasis, where the platelet plug form. The coagulation cascade is activated through two main pathways. The first is the intrinsic pathway, which is triggered by the internal damage, and extrinsic pathway, which is triggered by external trauma. Both these pathways converge to activate factor 10 and leading to the formation of thrombin. Thrombin converts fibrinogen into fibrin, creating a meshwork that strengthens the clot. This results in the formation of a stable fibrin clot, preventing further bleeding. Followed by this phase is the clot retraction and stabilization phase, where the clot is once formed, it needs to be strengthened and stabilized. Platelet containing actin and myosin, which contract and tightens the clot, reducing its size. This brings the wound edges together, helping in tissue repair. Then finally comes the stage of clot dissolution or the fibrinolysis phase, where after the vessel is healed, the clot is no longer needed and it should be removed. Plasminogen is an inactive enzyme in the clot, and it is activated by plasmin by tissue plasminogen activator. Plasmin digests the fibrin mesh, breaking down the clot and restoring normal flow of the blood. This is a crucial step. If the clot does not dissolve, then the clot will persist and it may cause the blockages in the circulation. So after going through the main phases of hemostasis, let's go through what happens at molecular and cellular level during the phase of hemostasis. First of all, there is endothelium disruption, which is a trigger point. Endothelium is the inner lining of blood vessels, acting as a protective barrier. Under the normal conditions, it maintains the blood fluidity by secreting anticoagulant like prostacyclins and nitric oxide. However, when the endothelium is damaged, the subendothelial matrix is exposed, triggering a series of reactions. First of all, there is exposure of collagen and von Willebrand factors to the circulating platelets. Endothelial cells lose their anticoagulant properties, allowing clotting factors to become activated, and this marks the beginning of hemostasis. Discuss in brief how collagen and von Willebrand factors are exposed to circulating platelets. Intact endothelium normally hides collagen and von Willebrand factors from platelet. But when they are damaged, the underlying extracellular matrix or subendothelial matrix is exposed. Blood vessels have collagen type 1, type 3 and type 6 collagen, and these collagens are usually hidden beneath the endothelium. But after an injury, collagen fibers are exposed. The collagen fibers provide a sticky surface which promote the platelet attachment to them. Platelets have specific receptors for that, glycoprotein 6, that directly binds to collagen. In case of injury, when the vessel is damaged, the endothelial cells release von Willebrand factor into the bloodstream. In addition to this, this factor is also present in subendothelial matrix and gets exposed along with the collagen. Here, platelets expresses a different kind of receptor which binds to von Willebrand factor. It is the factor glycoprotein 1b. So, von Willebrand factor, it acts as a bridge between the platelet glycoprotein 1b receptor and the exposed collagen, anchoring platelets to the injury site. So, in the patient who are having defective von Willebrand factors, it prevents proper platelet adhesion in those patients. Immediate response to blood vessel injury is the neural reflexes. They are immediately activated. The sympathetic nervous system sends signals to constrict the vessel, minimizing blood flow to the injured area. And within seconds, endothelial cells, they release endothelin 1. This is body's most potent vasoconstrictor, and it binds to the special receptors on the vascular smooth muscles, making the vessel contract further. Platelets come into action. As they adhere to the damaged area, they release thromboxane A2 and serotonin, two key molecules that further tighten the vessel and enhance clot formation. Over the time, secondary hemostasis begins, where the coagulation cascade forms a stable fibrin clot, reinforcing the platelet plug. Vascular smooth muscle surrounding the blood vessel is responsible for vasoconstriction. Here is what happens inside these cells. Vasoconstrictor molecules like endothelin 1, thromboxane A2 bind to their receptor on smooth muscle cells. This triggers an intracellular signaling cascade leading to the release of calcium ions. Calcium activates an enzyme called myosin light chain kinase. Myosin light chain kinase then enables myosin, the contractile protein, to interact with actin, causing the muscle contraction. As the smooth muscles tightens, the blood flow narrows and reducing the blood flow. If we talk about the regulation of vasoconstrictor, then it is regulated by various enhancers and inhibitors. Sympathetic nervous system norepinephrine stimulate alpha-1 adrenergic receptors. Hormones like epinephrine in high level, angiotensin 2 and vasopressin and endothelin 1, they all enhances the vasoconstriction. Apart from these two factors, the local factors like low temperature or hypoxia, as in case of pulmonary circulation. In contrast to sympathetic nervous system, parasympathetic nervous system indirectly reduces the vasoconstriction by decreasing sympathetic activity. Hormone like nitric oxide, prostacyclin and atrial natriuretic peptide and bradykinin, they also reduce the vasoconstriction. Local factors like high heat, hypoxia in systemic circulation and increased metabolic activity, these all inhibit or reduce the vasoconstriction. After vasoconstriction, it comes the phase of platelet plug formation, and this process is known as primary hemostasis. Primary hemostasis consists of three steps. First of all, there is platelet adhesion, as we have already discussed. A special protein known as von Willebrand factor, it helps the platelet to stick to the damaged area, and this is the first step in stopping the blood loss. Then after that there is platelet activated. When the platelet get ready to work, that means once they are stuck, the platelet change their shapes and become sticky. They release chemical signals like ADP, adenosine diphosphate, and thromboxane A2, which attract more platelets. And finally, these platelets aggregate together or clump together to form a plug. The platelets connect to each other using fibrinogen, forming a loose platelet plug. This is held together by a protein called as glycoprotein 2B and 3A. The initial platelet plug formed in primary hemostasis is weak. To strengthen it, a series of clotting factors work together, ultimately producing a strong fibrin clot. Platelets expose negatively charged phospholipids. It provides a site for clotting factor, platelet phospholipid, and calcium. The three pathways are there for coagulation cascade is extrinsic, which is a shortcut method. Think it as an emergency response when the blood vessel is injured. The tissue releases a signal called tissue factor, which quickly activates factor 7, leading to factor 10 activation, and this is calling an ambulance for a quick fix. An intrinsic factor is a backup team. Like if a damage is internal, the blood itself triggers the clotting through a slower but a thorough process. Factor 12, 11, 9 and 8, they work in sequence to activate factor 10, and this is like a careful repair crew fixing the damage from within. And final step is the common pathway, where once the factor 10 is activated, the factor 10 is activated in both the processes, extrinsic and intrinsic. Once it gets converted or it gets activated, it converts prothrombin, which is factor 2, into thrombin, and then thrombin act like a glue that changes fibrinogen into fibrin, forming a strong mesh-like clot to seal the wound. So when is the intrinsic or extrinsic pathway is required? Extrinsic pathway is required when the external trauma that damages the blood vessels and exposes tissue factor. The activation may be due to surgical wounds, trauma, tissue injury due to burns or inflammation. It is fast in response to stop external bleeding and initiates clot formation quickly after an injury. The intrinsic path is required when the damage is to the inner surface of the blood vessels without any external injury. The examples of activation of this pathway is plaque rupture in arteries, as in heart attack and stroke, blood stasis, as in case of deep vein thrombosis, artificial surfaces like heart valves or dialysis or catheters, or autoimmune disease like antiphospholipid syndrome. The key feature of intrinsic pathways, it is slower in response but amplifies clot formation. It reinforces and stabilizes the clot after initial activation. Once healing begins, the clot must be removed to restore normal blood flow. This process is called as fibrinolysis, that means the breakdown of a clot. First step is in this process is clot breakdown begins when the body no longer needs a clot. An inactive protein called plasminogen is activated by the enzymes like tissue plasminogen activator and urokinase. This converts plasminogen into plasmin, which is a key enzyme responsible for clot breakdown. Then the second step is the fibrin dissolution. Plasmin act like a scissors, cutting the fibrin mesh into fibrin degradation products, including D-dimers. This process slowly dissolves the clot, allowing blood to flow normally again. But this process must be carefully controlled. Too much plasmin can cause excessive bleeding, while too little can lead to dangerous clots. The body regulates this with plasminogen activator inhibitor 1, which limits the plasmin production, and alpha 2 antiplasmin which neutralizes extra plasmin. While the clot is being removed, growth factors like platelet-derived growth factor and vascular endothelial growth factors, they help to repair the vessel wall. So question arises, why don't we simply jump into the secondary hemostasis instead of primary hemostasis then secondary hemostasis? As a primary hemostasis, the platelet plug is the foundation. It provides a base for fibrin attachment. Without it, the clot would be weak. Also, the platelet surface is needed for the coagulation factor to be activated. Without them, fibrin formation is slow and ineffective. Platelet act within seconds while the coagulation cascade takes minutes to hours. Immediate control prevent excessive blood loss. So this was all about the hemostasis. See you in the next video. Till then, bye bye. Take care.